Hello there again. I'm Jan Sensier and I'm the Chief Executive of Engaging Communities Staffordshire, and we deliver Healthwatch Staffordshire. Healthwatch Staffordshire is the body that monitors the quality, the delivery, the planning of health and social care services across the county, and we monitor it on behalf of patients and service users. I know that many people in Staffordshire have been very concerned about the changes that are happening to our health and social care services in the county, particularly our hospitals. And I spoke before about the work that we've been doing at Healthwatch Staffordshire to assure ourselves that really full and detailed plans are being laid to make sure that patient safety is absolutely at the heart of those changes. Recently, I took part in another one of these assurance panels. This one was on the proposed move of paediatrics from Stafford, the county hospital, to both Wolverhampton and to Stoke. You will know that at the moment we have the Shugborough ward at County Hospital, which has a very good reputation amongst local people and is seen as an extremely good service. The Trust Special Administrator's report stated that paediatric inpatient services were no longer clinically and financially sustainable in the long term and should be moved most prominently to the Royal Stoke University Hospital, but also to New Cross in Wolverhampton for those people that live nearer to the Cannock end. Now these moves are really being planned in great detail, and as I say, last week we had a further assurance panel to look at the detail of those plans and to assure ourselves that the plans stack up, that they stack up in terms of patient safety, in terms of efficiency and the best use of services, and that also things such as transport for visitors has been taken into account, because one of the things I'm really worried about is how parents are going to get to see sick children if they're too far away. I think it's fair to say that we were assured by the plans that we heard. There are some more stages to be gone through, and there will be public board meetings, particularly at the two trusts, and I urge anybody that's interested in these issues to attend those board meetings and to listen to the work that's being done. For me, one of the most important issues is that all those patients that currently have what they call open access at Shugborough ward, and patients with long-term conditions that have been multiple users of the services here in Stafford, that they are given a care plan, that's discussed with them and their parents, and that's all in place way before the moves take place. And transport's another key issue, and we've made some recommendations about how that should be taken forward to make sure that transport is in place for those patients and for their parents and their carers. In the wider scheme of things, in the last couple of weeks, we've had the leaking of the long-awaited report into Staffordshire and Stoke-on-Trent as a financially challenged health economy. Locally, I think we've called this the KPMG report, because it was KPMG that were brought in to actually write this review. There have been quite a lot of headlines in the newspapers over the last few weeks about this, and I think what can get lost in all of that is that 23 recommendations were made about the future of health and social care services in Staffordshire, and about how they should be really centred on populations, on small populations, giving us integrated services which would help save money but also help to improve services and improve outcomes for patients. I think it's really important that we all, as people living and working within Staffordshire, understand those recommendations, and that there is now really, really good public engagement around those recommendations. I'm urging this as a member of the Health and Wellbeing Board. I have written and asked that there be that public engagement. I've also raised it with the national bodies that commissioned the report, and I will continue to do so. I hope that you'll be hearing more from me on this over the next few weeks and months, because this is a subject I think is really important to the future of our services in Staffordshire, and I will continue to press it. Finally, we have had some changes already in services in Staffordshire, one of those being maternity. And one of the things that was promised by the government at the time when they signed off the recommendations of the Trust Special Administrator was that there should be a maternity review, a review of maternity services, particularly in smaller hospitals. And again, in the last couple of weeks, we've had the Morecambe Bay report published, and lo and behold, the same day we had that national review, now it's turned into, of maternity services published as well. The terms of reference were published, but as yet with very little detail. Again, I have written to NHS England and I have asked them for that detail, and I've asked them particularly about what engagement there's going to be with patients in terms of taking that review forward. And I've also included Healthwatch England, our national body, in that, because I think there's a real role for health watches up and down the country to play in making sure that there's really strong patient engagement in that review. Again, I won't let that lie. I'll keep continuing to press, and I hope to get back to you on that shortly. In the meantime, if anybody has any concerns about their health and social care in this county, in Staffordshire, please do contact Healthwatch Staffordshire. The number is shown on the screen. We've also got our website. Please contact us, and don't forget our experience exchange, where you can leave your comments and your feedback about the quality of services you've received. Your feedback's really important to us, and please don't hesitate to contact us.